listening to Practice on Purpose, where physicians can explore how to set up their career on purpose from the very beginning to stay connected to their purpose for their entire career. I'm Dr. Nicole Eull, a health psychologist with decades of experience in healthcare, from front lines of a level 1 trauma center to the leadership in one of the largest healthcare systems in the country. I'm passionate about physician well-being and creating mentally healthy workplaces. If you want to thoughtfully establish a career that aligns with your values and passions and ensure a long and rewarding life as a physician, then you have come to the right place. Today, we are talking about financial planning for physicians. Our guests are Katie Jacobson, a certified financial planner, and Nick Nyhus, Chief Administrative Officer with University of Minnesota Physicians, and he is also an industrial organizational psychologist. Both are joining us from Minneapolis, Minnesota. Welcome to Katie and Nick.
Thanks, Nicole.
Thanks.
So glad to have you guys here. Katie, is there anything more you want to add to your introduction?
Well, if it's helpful context, I actually did not start my career in financial planning. I started as a healthcare IT implementation specialist project manager for Epic, based out of Madison, Wisconsin. And then I was over actually at Capitol Hill at the Library of Congress in the Congressional Relations Office. So I've kind of been all over, but the common denominator has pretty much always been people. So now my people are everywhere, so we are able to stay connected pretty much across the country, but it's nice to have Nick in the backyard. That part's fun.
Yeah. So Nick, what about you?
Yeah, thanks, Nicole. So I have the privilege of working with a lot of physicians, both from primary care and specialists. Our practice is the specialty arm and faculty practice plan at the University of Minnesota. So I get to work with physicians all the time, day in and day out, and get to see their career traverse from being a resident through fellowship into retirement as well. So I'm glad to be here as well.
Great. So one of the things I want to start with is just, what are your people struggling with? What are your clients or the people you work with? What are they struggling with regard to finances? What comes up for them?
Nick, do you want to take that one?
Sure. I'd say it depends a little bit on phase of career, but student loans are a huge one. And I think that, they can go on for quite a long time, and especially with the public student loan forgiveness program, that payment takes a long time. So I would say age really doesn't matter unless you're really towards the very end of your career. But I know it's one of the things that weighs on a lot of new physicians' minds is that financial burden and debt, and especially if their significant other or spouse is a physician as well. Sometimes you have double the debt in those situations as well. And then, of course, getting out of residency and establishing, for those that want to establish a family, I would say, that one of the challenges is they've been in school so long that their financial growth is a little bit stunted because they haven't been making as much money as maybe some of their peers in other professions. And so they get a little bit later start. And as Katie can attest, that compounds all the way through retirement. So I think just the whole overwhelming perspective of financial planning, what is it? I just got out of school. What else do you want me to do now? I just like a car, for example, I think is one of the things that they are challenged with.
Yeah, I can totally relate to all of that. Just as also having a doctorate in psychology, just you delay so long and you feel like other people you went to school with maybe have really started their financial life much earlier, and it can be very frustrating. What about you, Katie?
Well, I think Nick nailed it. Most of it, a lot of the stressors, I think, come from context and the lack of having context of knowing what comes next. I think it's really important, particularly for physicians, to remember that their variables are by default completely different than maybe the college roommate who graduated and went to corporate America at 22 and has been funding a 401k for the last 8 years. But at the same time, you're still in that same age echelon and you still are seeing the lifestyles that other people have. And it's hard sometimes to remember the context of I have different variables, I have different outcomes. But that context also applies inside the financial plan because there's lots of noise. The internet's a really great place, but much like I'm sure on the doctor side, people aren't super thrilled with WebMD. The same thing happens to us where sometimes it's well, you're asking the right questions, but you might be getting the wrong answers because you don't have the context to recognize that this is not advice that's specific to you. So helping people to figure out all right, the world could be really big, but we can narrow it down and take it step by step Because one thing that physicians in particular are very good at is school. They're very good at if then thinking. So I think a lot of my job is figuring out the psychology of whoever I am in front of and making sure that we set up the next steps to lower the dissonance, lower the noise, and make it easy to just continuously make progress. And pretty soon, the mountain is just a few steps every time. It gets a lot easier that way.
And are
Yeah.
you guys seeing, sorry, Nick, go ahead.
I was going to say, I would add one of the biggest challenges, I think, is the willingness to ask for help. I think going through med school, right, you're seen as the expert. You get out of med school and you're now a doctor and you're the expert. And I think sometimes it's hard to say, I'm not the expert at financial planning, and who do I go to and how do I reach out for help, and where's a reliable source to seek that information out?
Do you guys feel that most physicians early in their career feel like they're thriving financially or not?
0 out of 10. I think that unless they are an outlier, most physicians they might put on a good show, but I think when you get underneath it, some of them know what they're doing for sure, but also a lot of it comes into time and capacity and whether or not you have enough of both of those in order to manage your emotional life and your physical life and your professional life, and then also your financial life. Like that gets to be a lot. So finding someone to delegate that to is helpful. Like obviously math is very relevant to the work that I do, but I would argue that probably the biggest barrier to entry on a lot of this stuff is behavior. Whether we're managing what happens when the market crashes or if someone loses a job, like how do we handle those changes? But also on the regular, how are we setting up systems so that we can maximize whatever cash flow you have so that it's setting you up for something better and it's an easier way to manage we're simplifying the questions, basically.
Mm-hmm.
I don't know very many, it's not just doctors, but universally, I'm not sure. We don't train many Americans to do this in school. We're not taught this thought process. So it doesn't blow my mind that most people don't have confidence or context to do it independently.
Mm-hmm.
Yeah, I would add, I think the system is designed to work this way. And I think accepting that is an important part of this, meaning you're going through a lot of intensive training. It's very hard to work. And when you are working, you're working as a resident for, and let's be honest, not optimal pay and long hours still, right?
Yeah.
And so the system is set up that way. And I think part of this is to just accept that's what it is and be okay with, and I think the context that Katie talked about is so important, to know that you're in the same boat as everyone else that's going through this. And you're not doing anything wrong. And there's so many variables you can control. But I think when you're done, that is when you can be in the driver's seat and make those decisions on how to set yourself up financially and get caught up. And I think it is possible to get caught up, but I think that it's important to know what are those tools and levers you can pull to accelerate that growth. Otherwise, it can be very overwhelming. And I think sometimes people get caught in that kind of spiral and like, I'm never going to get out of this. And why did I pick this career? And they start losing the joy of practice. I think that's important just to stay connected to that. How do I stay connected to my purpose while at the same time and be okay to make money? I think that's the other thing. Sometimes the mission conflicts with people. It's like, I shouldn't be making money and it's okay to make money. And sometimes you can fulfill both missions.
Yeah, I think I've noticed in residents and in psychologists too, we don't get any training in business or how to negotiate a salary or how to plan our finances neatly. And I think you put off your life for so many years to sometimes, not just residency, but very long fellowships and maybe even subspecialty fellowships. And then suddenly you finally feel like I've earned this chance to have fun and enjoy my money and maybe live have a living wage. But you've also put your life on hold. A lot of people put their life on hold. So then they start having children, they start buying houses, they start putting these children in childcare and daycare. And how do you see that affecting people?
Yeah, I think childcare in particular in the state of Minnesota is very costly because it's a high quality. And for a lot of people, that can be the equivalent of student loan payments, if not more. And doing the analysis, if you have a significant other or spouse that's working, I think that's the other part of financial planning is what's my time worth and is it worth that person working and those types of things as well, and being respectful of their career and choices. through all of that. And then at the same time, understanding what is my debt service available to me and my income. And I think one of the biggest challenges physicians have is physician compensation can be extremely hard to understand.
Yeah.
I think a lot of people think, oh, I visit, all doctors get paid the same. And then I think people realize that specialties vary, but whether you get paid by work RVU or salaried or clinical FTE or those types of things, I think it's important as a physician to ask those questions early and understand, because if you don't, it can be very disenfranchising when you find out that your expectations aren't being met or you don't understand what those are. And especially if you're going to be an academic physician versus a community physician, understanding all the nuances that come with that, including the trade-offs, I think is important. And I think, Nicole, goes back to your point about learning about negotiation skills, right? It's asking a lot of questions and seeking and being curious. I think the number one thing I would recommend is be curious and ask a lot of questions.
Right. And ask for help, as you said, right? I'm curious to learn more about your partnership and how did you two come to know each other and how are you working together?
Yeah, that's a great question. So we've had a focus on physician well-being in general for quite a while. We, of course, have a traditional employee assistance program, but we've broadened that out to include a physician and provider concierge program that focuses on the day-to-day things that physicians do at home. So it could be, I need a babysitter, I need daycare, I need a pet sitter, I need concert tickets, I'm trying to get a movie reservation type of thing, to try to release a bit of that burden on behalf of just the day-to-day things that go on in the household as well. But we became acutely aware that financial planning was important too. We have a 401k plan in our organization with a 457B plan. And, these are all IRS tax codes. And you could see some physicians' eyes were starting to gloss over already. And we said, you know what, we need to provide some education and help. So we asked some financial planners like Katie to come in and provide education. And as not understandably confusing, but physicians like to hear from experts too in their field. And so we thought it was important from a credibility standpoint to have somebody that's an expert in their field talk about a lot of these things, because the tax codes and all those things can be just incredibly confusing for people. And with IRS limits and all of those types of things, it can easily shut people down and say, I'm just not going to bother. This is too confusing for me. So that's how we engage Katie. And we have Katie come talk to physicians and residents and provide education seminars specifically on deeper dives on these topics.
So Katie, as you're working with these residents and physicians, you've learned some stuff, I'm sure, because you're a smart person. You've learned stuff from hearing about the concerns that these physicians have. So out of that, what are some things that you would love people to know?
Well, I think that my side of the coin, having someone like Nick is wildly helpful, because my number one challenge, I think, is to make sure that whenever I'm speaking with someone, it's on their terms. So I, at my core, believe that money needs to be consensual, and it almost never is. And not because anyone's doing anything like malicious, but mostly because we don't train everyone in school on these are the rules of the game when it comes to money, but we still expect people to know the outcomes. So one perspective I have on my job is that it's my job to also infuse consent back in these conversations, which means that I need to know the context of whatever life stage that someone is in, and probably what their to-do list looks like. Because like I said, a resident is going to have very different context than a attending. And depending on the financial planning that they may or may not have already done, we're starting at a different point. And that's super normal. The kid thing is super normal. What I would really like people to know is that we've had a lot of conversations lately with dual income physician households, dual income attorney households, dual income corporate climber households, who are really struggling with a fair amount of guilt and almost shame about the fact that they know that they're a high income earner. They might be a top 1%, 5%, 10% household, but they are simultaneously also very much so paycheck to paycheck. And that is normal. For anyone listening who might feel very seen, good. You are not alone. That is normal. You are not a bad person. In Minneapolis, Nick was right. Healthcare is crazy expensive, or not healthcare, excuse me. Childcare is really expensive. A parent who's trying to figure out sending one kid to daycare should expect probably at least $500 a week to go towards a childcare budget. And that's $24,000 a year that just got eaten.
Right.
But there's always a silver lining when it comes to thinking about something that is like a debt payment with a timeline. So potentially student loans or credit card debt or childcare, is that technically all of those people who are able to pay those things, they're actually incredible savers. The problem is that they are not the beneficiary of all their own hard work. So for my parents, even though we're in this dark, lean chapter that feels awful, we're in a tunnel. There is a light at the end of the tunnel that will happen no matter what, just because of time. Even if you never get raises, even if like all that happens is your kid ages out, we just increased what you are able to save into your plan by 24 grand. Like that math will compound and that will look a lot more compelling. But part of my trick is to figure out like, how do we balance the fact that obviously we need the financial plan to work in the future. So we do need to save, but also all of the future variables are unknown, and YOLO, my bias is that YOLO is real. So that's why I think that working on a cash flow basis to be able to figure out like, Nicole, will it bring you more joy if we spend more money, especially someone who's going to have a big income jump? Like if I'm going to go from residency to an attending and I might go from 60 to 600,000, like I would also be so tempted to be like, I am getting all the things. And sometimes that's okay. But part of when we work with a cash flow management system is that then it creates an environment of conscious spending. And that means it's guilt-free spending, because then we can unconsciously save. And it's so liberating to be able to know that whatever decisions you are making on a day-to-day basis, you've already taken care of future you, and the mental health of present day you is like good to go. And hopefully that means that you can stay in an environment that might be stressful, like being a doctor, longer, and can continue to earn some of those incomes and set yourself up for a really good financial future.
So it's really a mindset. It's really having that mindset to be free and to say, okay, we pay ourselves first. We take care of the things that I've promised myself long term. I mean, as someone who goes through medical school, you already know how to delay gratification, right?
Correct.
To put in hard work to delay gratification for a big payoff later, hopefully a big payoff later. So you help your clients get that mindset right of what needs to be saved and then what can be enjoyed. And when you're enjoying it, you can do it guilt-free because you know that you've made a plan, right?
Sure.
Nick, I'm curious to know, how are people responding to this? And I want to say this first. I have heard in concept and theory of physician concierge, and I've never seen a program actually do it to the breadth that you are doing it. So I'd love to hear how physicians are responding to that.
Yeah, it's a great program. We chose an organization that is run by physicians, so they understand what a physician is going through. So in addition to leadership coaching and counseling, like I said, the typical employee assistance program, things from broader mental health issues, from addiction to other psychological needs. We just saw a need where they just said, if you could just make my day-to-day life easier, how can we do that? Because I get home and I'm rushed, I'm picking up the kids or taking care of an aging parent, which is happening more and more frequently. And the other thing I think to acknowledge is that physicians move around a lot early in their career, right? From match day just happened not too long ago here. So we have physicians that are learning where they're moving and they're uprooting their families and taking them with them. And so we recognized we needed something to help offload some of those day-to-day stressors, because we knew that, I think it was the last study I saw, 79% of residents feel that their mental health is at risk, right? And it's hard to ask for help. And so we thought, what are the other ways? How do we get ahead of that? And one of the ways we get ahead of that is just the day-to-day things. And they sound simple. So we've had one of the funniest things we do is we ask our physicians to, quote, break the system, meaning, ask for the craziest thing you can think of. And we've had things from, here's a picture of a rug. I need a lamp that matches it. Can you find it? And the organization will send them pictures and give them links to where to go find things like that. And it sounds silly, but if that's what's causing stress at home, because they're trying to finish, it's an incomplete or unfinished business item, for example, and we make this available to their families too, so that their significant other or spouse has access to this, because we know that they're behind the scenes supporting these people in their careers, right? And the great work they're doing. So, and like I said, it ranges anywhere from finding a nanny to babysitters to backup childcare. We also offer emergency backup childcare because we know that's a significant stressor. We don't want physicians coming in if they're ill either. And so we want to make sure that they take care of themselves all holistically around that as well, and to be with their kids because we know that you get one shot as kids grow up. And so we try to find ways to make sure we can maximize their time with their families in these crazy schedules. So this concierge program has really taken off and is kind of we see it as a differentiator for hiring people in the door and retain them as well. But it has been challenging to get people to use it, right? Because they're like, oh, what do I, are you sure it can do this? And know this. And there's simple things in there too, like financial planning things. We provide a credit for financial planning through our well-being account as well. But through this concierge, you can download simple things like a tax preparation software program or a will generator just to get you started, and then get referrals onto professionals that can help you. So there's a wealth of professionals that they can refer to on specific things, whether it's estate planning or financial planning or anything you can think of to make life easier.
So this is blowing my mind because this sounds amazing. And
isn't it cool?
I commend you all for making that move. I'm curious if there happens to be anyone listening who's thinking, gosh, could we bring that to our organization? How does it make financial sense for you? What benefits are you all seeing as an organization when you take care of physicians in this way?
Yeah, I would say the number one thing we see is just retention through and diminishing burnout where we can, right? Let's be honest, burnout is a significant factor in healthcare right now because there's so many competing pressures. I know our hospitals are constantly busy. It has not let up since the pandemic. And so I think the pandemic also really helped people become either hyper-focused on their careers, or for some people, they self-selected out just because of the sheer pressure and timing of it as close to retirement. But I would say that what it does is, as Katie mentioned, it kind of eases some of that burden so you can focus on other things and reconnect with that purpose and passion while you're in medicine. So it's not having to worry about things at home while you're at work is, I think, a huge impact that we have on our people, because we bring entire selves to work, and it's always in the back of your mind. I wonder what's going on. Did somebody pick my son up from daycare? Did this get done? Did that get done? And I think if we can alleviate that burden, whether they're on an 8-hour shift or a 12-hour shift or a 24-hour shift, that they can focus on their work at hand and not have to worry about what's going on at home.
Yeah.
I think that's one of the biggest pieces of feedback we've received is, it helps me relax and be able to compartmentalize my work.
I think, a lot of physicians use the term that they want to practice at the top of their license. So using, work time and mental energy for things that could be delegated allows them to really use their greatest talents to their greatest potential, I think. So kudos to you guys. Katie, if I am a young medical professional, when is it time to seek professional help from a financial planner?
Well, money almost always is somehow tied to the shape of an exponential growth curve, and almost always the x-axis is time. So usually that answer is yesterday, but obviously there's nothing we can do about that. So anyone who's asking themselves that question, it probably is in a really good spot to start doing some of the planning. There are some basic metrics that put you in a position to be able to take off. So easy things like making sure that you're cash flow positive. You are spending less money every month than you make. So there is leftover dollars that could be budgeted potentially to savings. From a suitability perspective, I always need to make sure that, to the best of our knowledge, whatever we are implementing is going to stick and we're going to build upon it. So having the basics like enough savings in your emergency fund, enough cash, taking care of any credit card debt, making sure we're enrolled in the right student loan forgiveness program or whatever it might look like, any of the benefits that are available through work that might have a match, are we getting those? If we're checking all of those boxes, the final thing that I would hope people are ready to do is they are ready and willing to take someone's advice. And that's actually why I think residents and fellows are in a really good position to find their person in my role, because they're used to collaborating already and used to learning. And my personal preference, I don't really find any joy fighting somebody and convincing them that I'm smarter than them when it comes to money. I don't think that's useful. I'm much more interested in collaborating on the outcome. And when we can grow together, we're able to pull off a lot more because we also trust a lot more and people are willing to take my advice.
Mm-hmm.
Tactically, though, I would say that people who are looking to interview somebody, I would make sure, number one, that they have the certified financial planner designation. That means that whoever holds that is held to the highest legal standard of care in my industry, which is the fiduciary standard of care. I would also make sure that whomever they are interviewing really understands medicine. They don't just say they work with doctors, they actually truly understand it.
Yeah.
I think an easy way to test that is just generically ask about PSLF. If the advisor doesn't know that acronym or isn't quite sure what that means, they probably don't really work super well with physicians. And then just like picking out your PCP, it's got to be someone you trust.
Mm-hmm.
All advisors are going to leverage some form of an algorithm to build out a financial plan, and the output of any financial plan is going to be completely dependent upon the data we feed it. If we're not willing to be honest from the get-go and collaborate and take one another's advice, then the plan that we kick out isn't a plan at all.
I think this is so important because I say this, and I don't know, Nick is also a psychologist. I think I always say people put more time and energy into picking out a pair of shoes than they do picking out the right therapist or financial planner. They just maybe go with whoever was recommended to them, whoever their insurance covers, or in your case, maybe someone said, this person specializes in physicians, but maybe it's just not the right philosophical connection or whatever. It's okay to interview and vet people and find the person that's right for you and really gets you and gets your values and doesn't make you feel guilty about them. Maybe they'll push you a little, but that they're collaborating with you truly and help and really get your values. What I wanted to ask you to clarify is because I didn't understand this, and I'd say in my 40s, I'm paying much more attention to my 401ks and all these things than I was when I was in my 20s. And I wish I had paid more attention. But can you say more about why you would want a certified financial planner and this fiduciary responsibility? Because I don't think everyone really understands that.
It's become a buzzword ever since like John Oliver did that episode on being a fiduciary. But I do think it's important because there currently, and this is up for debate in Congress on whether or not it's going to stay this way, but in this moment, there are two standards of care in my world. One is best interest, which that's like what happens inside of a 401k. They are establishing suitability. Is this the right thing to do for this person in this moment? And then that's kind of the end of that time frame. A fiduciary is responsible for making sure that you have a suitable recommendation both now and in the future. And I always have to disclose how I'm paid. Like, I think that ethically you should be doing that anyway. We should be honest about that. But the fiduciary is elevated to needing to, for instance, I need to check in with my clients when I'm actively managing their investments. I need to talk to them at least once a year and make sure that how we're doing it is still accurate, and making sure that we have on the growth side, we've got the investments moving in the risk tolerance and the timelines and all those other pieces. On the protection side, we have the right insurances. So whether it be life insurance, health insurance, disability insurance, long-term care, and then thinking through, well, what about a legacy? What about my kids? What about my future education, or perhaps buying a house, equity in a business or a rental property? All of those pieces are the puzzle that are why I have a job. We're constantly reorganizing them, because even if someone had identical variables, they might not have the same value systems. So it's the same analogy as if you've got, 3 medical specialists looking at the same patient chart. They all have the same goal of making that patient healthier, but they might all do it in slightly different ways. Money's the same. Money and medicine are very parallel. So part of that interview process is also finding out whether or not you share the same philosophies on how you plan, because my industry is notorious for using the same type of word, like financial advisor, but meaning a drastically different scope. So making sure that whoever you're interviewing can articulate what that means is really important. And the CFP helps to unify what that means. And it's quite holistic.
And you're held to the highest ethical standards. So I think that's really important for the layperson in the audience listening to understand. Now, Katie, you have some tools that you are willing to offer us in the audience today, and they'll be in the show notes.
Yes.
Would you like to tell us a little bit about those?
Yes, for sure. So first of all, thank you for being willing to share these with people. I think they are very important. So as a call to action, for lack of a better term, if I were listening, I would want to make sure, number one, that I know what my own variables look like. So that would be, do you know your own cash flow? Are you enrolled in the right student loan program? Are you getting your employer match? Those types of things. That can be very overwhelming, because at least when I was trying to figure it out for myself before I was in that role, I didn't know if I had a completed list or not. And if I didn't know what I didn't know. So if I missed something, it wasn't me trying to be dumb. It was just, I missed it. So there will be a link in the show notes to a tool that is about like a 2-minute form that will ask prescriptive high-level questions that will kick out a result, a red, yellow, or green result on how your foundational planning is sitting. And if you choose to submit that, like, you can see that without submitting it, but if you choose to submit that, that will actually get sent back to my team as an indicator to follow up and see if it makes sense to connect one-on-one and talk things through. We are happy to be one of the people who would be interviewed to see if we're your right fit. And if not, we have a lot of advisors across the country who I would quantify as medical specialists, and I'm happy to make those connections with other people as well. So that's not a problem. I think that's probably the biggest call to action for 2 minutes to knock that one out.
And if you're red, should you panic?
No. I mean, almost everybody is probably going to have quite a fair amount of red, because they're going to ask you, for instance, annually, what are you saving? And perfect world, we want you to be able to kind of quantify, well, maybe I've got $7,000 for a Roth IRA, and maybe I'm putting in a match, so I've got another insert dollar amount here. But if you have an income that is mostly being used for other things, that's a chapter. And that doesn't mean that we can't utilize what's left over and still have some YOLO on the back end, but it's all a chapter. But it does help to prioritize what's immediately on my list. And then whoever's in my seat can help to answer why.
Yeah, and I think that the key there, to me, I would advise, is just to be brutally honest in that tool. It is not the time to fantasize and kind of try to pull the wool over. You're try to impress the financial planner. And I think that's one of the things that we see, is that people just don't want to face what the reality may be. And maybe it's not your ideal circumstance, but I think that's why it is so important to get started early. Even if you think, oh, I don't have enough money for a financial planner, you do to get that advice. I think and it's so important to put it all out there and say, and here's where I want to go. And I think that's to find a financial planner that is kind of shame-free and judgment-free. Because I think we've all been there, right? And again, I think physicians in particular think they're supposed to be the experts on everything. And I think, Katie, you touched on one part that I'd just like to mention. Health insurance can be very confusing.
So confusing.
And so I think what happens is that family members come to doctors and go, here, help me figure out my health insurance. You're not an expert at that, and that's okay. And that can be quite costly for your family if you don't have somebody guiding you through and asking you questions about usage and those types of things too. So it's not only just the money you're earning, but the money that you're letting go out the door just unconsciously, because you might be afraid or ashamed to, I should know this answer. I don't want to ask, or I don't want to admit I have a therapist or a planner, which I think to your part earlier is one of the stigmas.
Green light on the therapist. No, I think but that's one of the things I appreciate the most about being able to collaborate with Nick and people in other organizations. I really like it that it's common for physician leadership, residency program directors, senior physicians to pay it forward and to expose other people to the information. The real catch is making sure that whomever is delivering that advice, making sure that it is the most up-to-date and relevant for whoever that audience is. So by having this collaboration with Nick and with the U, it helps to be able to know that when you have a question, you can raise your hand and you can ask me. You will not be solicited for the rest of time, and you will not be shamed for not already knowing this question. I think that is vitally, vitally, vitally important. If I were on the other side of the communication, how would I want, what would I need in order to feel comfortable and confident with making that next step? If I don't behave the way I would like to be treated, then I don't think it's going to work. So we work really hard to make sure we're doing that.
And Nick, to your point, I think it's so important to be honest with yourself and with the person. That's why you need to find a financial planner that you're comfortable with, because you need to be able to be honest. I have a friend who is currently taking a weight loss drug. Won't mention by name. And this friend is going to another doctor to get this weight loss drug and not telling their regular doctor about the drug because they feel like they would be judged. And I'm sure most of the medical professionals listening right now are cringing and thinking, why would you not tell your doctor all the information that they need to give you the best care possible? And it's the same with financial planning. We want to make sure that you're getting all the nuances addressed and the leakholes and the strengths and the weaknesses.
So I think, Nicole, you also bring up, I think, the importance of being honest with your significant other or spouse, right? Because not only are you supposed to be the expert in your field, right? I think sometimes at home, because you're highly educated, you're expected to have everything together, know every single thing. And I think that requires a bit of vulnerability to be open with your family on, here's our circumstance, right? Whether you have older kids or younger kids, or here's what we're trying to do. And having conversations like, do we want to send our kids to private school, and what's that expense compared to public school? Or is this the type of car we want to have, or those types of things? I think so often we see that's where relationship challenges come, is when the financial situation hasn't been talked about early on or clearly, or what those goals look like as well.
I think a lot of financial planning is psychology, right? Is understanding your mindset. I know we've talked in the past, Katie, about just what is your mindset? Is your mindset that I'm paying myself first, I'm saving, and then I enjoy the money that's left over? Or is the mindset, I deserve this, and then you start making decisions in the moment that long-term will have major consequences. And I see physicians at the end of their career who are still working well past 65. And I get the sense that some of them are doing it because they love it, and others are doing it because they didn't set that groundwork early on in their career and make good financial decisions early on. And so they're working because they have to continue to pay off debt and the lifestyle that they've created around themselves. So one of the things I always say to young medical professionals is really take your time, thoughtfully think about what you want your life to look like, and then plan your career around that. And I think it's the same for finances, is figure out what you want your life to look like, and then plan the finances around that. And rather than being backed into a hole and not having financial freedom to make the decisions that make you happy.
And that's why I think the power move is to know your cash flow. Because I will ask you, like with clients, I just talked to an attorney this morning, like eventually I'm going to ask you, will it bring you more joy to spend more money? And at some point you might tell me no. And by default, that means that we are going to save everything else. And particularly in a profession that can have such a large jump just because of time in income, I totally get it. I would also be like, dang, look at me. Like, I'm going to go spend this money. And that's okay. Some of it being spent is probably appropriate. We don't know until we dig into what each individual's details look like. But that's why I think owning cash flow and really knowing what's happening and making a conscious decision on what you're doing, setting yourself up to guilt-free spend is wildly valuable. But the other aspects to that I think is really important, in addition to Nick talking about like all the wellness tools and whatnot, whoever is the resource at your institution, whoever might be sitting in my seat as a financial planner, they should also have a wealth of referrals to other professionals who can help to amplify your financial future. So
say more about that. So say like who, because you have introduced me to lots of very interesting people and you have a great network.
But like whether it's something like a CPA or an estate planning attorney, so we figure out taxes and your will and trust and healthcare directive and everything, or if it might be the proper student loan resource, which is probably different depending on if you are PSLF eligible or not, federal loans or private loans, making sure you know which one is probably appropriate for you because they're not all built the same. I refer like Candy, a physician contract negotiator, and a like corporate traditional contract negotiator, resume builders. Obviously, any of the financial plan is dependent upon the variables we give it and the income that we feed it. But like
Right.
this contract negotiator got one of my pediatricians, I think it was a $40,000 increase in the base salary when she
Mhm.
becomes an attending, plus a $30,000 sign-on bonus from an org that really stereotypically doesn't negotiate. And it's because he knew which doors were flexible versus which ones were hard. And
Right.
now for her, she is going to like that will be her baseline from which all other contracts will be negotiated. So
Mhm.
she is already ahead of the game just by default. And like I'm thrilled as a financial planning perspective. I'm thrilled. But what's so
Yeah.
much more fun was how excited she was because
Right.
she felt so valuable and so seen and excited about her career. Like she got a good offer, but being able to amplify that it was just fun. And then we got to celebrate.
Mhm.
And I think money involves a lot of opportunities to celebrate if we tee it up in the right way.
So Nick, what do you think, as you all are offering something very unique, I think, in the physician world, and I think it may catch on, as more people see that you retain more physicians. What should people be looking for as they think about the variables on the table when they're deciding where to work?
Yeah, great question. So I think as Katie said, understanding the financial model, like how am I going to get paid?
Mhm.
Is this a salary position? Is this a kind of work RVU position? What
Mhm.
would my day to day look like? Because I think that's the other thing. Sometimes we get caught up in the monetary part, which is important, but we forget, well, what's my schedule going to be like? And is there an opportunity for call, or is call included? All the ancillary payments that come with that. Could I be a medical director? And what's the compensation for that? And what's the time commitment? Could I be teaching students? Right. And so am I going to be a preceptor or those types of things? And understanding what that is. And then sign-on bonuses, right? Are there clawback provisions? Do I have repayment, forgivable loans are another one that are common tool used for physician
Mhm.
recruiting, and understanding what that means and what happens if I have to make a different choice. Where will I practice? I think is another important thing to ask. Is there multi-sites? Because before you know it, you could be driving across a large metropolitan area and what money you had left was eaten up in gas, for example. So I think I think sometimes in our first jobs, we
Right.
get really excited and we take what comes without asking those
Mhm.
questions. And I think there's a way to be diplomatic and out of
Oh, for sure.
curiosity, right? And it's coming from that place of curiosity,
Yeah.
and asking and having your list ahead of time as you go into uh,
Mhm.
the negotiations, right? And not to be afraid to negotiate. The worst case scenario is they can say no, right?
Mhm.
And sometimes we don't like that rejection piece, or we feel like I'm not worthy to ask for this amount of money. As long as it's not over the top and extravagant, there's always that risk that somebody's going to say, "Oh, can you believe what he asked for?" But why not? Like again, worst case scenario is they say no, right?
Right.
And
And not
that's
negotiating is by default negotiating against yourself. Like
yeah,
Right.
if
Yeah.
you don't
exactly.
ask, the answer is definitely no. And I think, again, from a psychological perspective, having some of those professionals to say, like, Nick, you should ask for this. And here's the order in which you ask for it, and to what degree, and why.
Mhm.
And here's
Right.
how you can phrase it and still be polite. And here's your line in the same. We're willing to give on this, and we're not willing to give on that. In all of the negotiations I've seen, and I've been doing this since 2016, I have never seen an offer rescinded. I have seen a few people say, like, thank you for asking. The answer is no, but I've
Mhm.
never seen an offer rescinded when it was respectfully negotiated
I
ever.
think that's really important to emphasize is that there really isn't much of a consequence to at least ask.
Mhm.
So I want to finish up by asking you guys some questions about you, just in the life that you choose and the careers that you've chosen. I'm going to give you some rapid fire questions to answer briefly as we finish up. So we'll start with Nick. What is your greatest passion or purpose?
Yeah, I think now my greatest passion or purpose is just to, at this stage in my career, to be of help of people.
Hmm.
I've been doing this for over 30 years. I started off in financial services and migrated my way through education and ended up in healthcare over the last 10 years. And it's very mission driven and personal for me to be able to help change healthcare and get tomorrow's leaders ready. I think there's a huge opportunity for physicians to step up in leadership roles and get them ready for that. And then the happier, let's be honest, the happier my physician is the better care I'm going to get. So I
Yep.
think it benefits us all if we have physicians that are healthy and emotionally and physically and mentally and even spiritually aligned with the work that they're doing. So I think that's one of the key things for me that's very important to do.
And how does your current job keep you aligned with that purpose?
Yeah, it's great. Being in academic medicine, I'm around a bunch of incredibly smart people that are working on breakthroughs every day, trying to either cure that rare form of cancer or working with children in particular. And so being able to support that, I think being in a support role and enabling them to do the jobs we hired them to do. So my job really is to make the administrative part of our practice easier so that they can come in and focus on what they were hired to do and get rid of what I call all the noise and the administrivia out of the way.
That's great.
Can't eliminate it completely, but that aspect of it is really to how do we get them back to being able to practice and find the joy in medicine again, which I think has been challenging in these last several years.
So, Katie, what about you? What is your greatest passion or purpose?
I mean, Nick summed it up pretty well, so that's why we work well together. But my passion is people, and I'm in the medical community because medicine gave me what I value most in the world, which is hope and time with the people who I value most. So I find this to be a really, really good way to pay it forward and to use my skill sets and my resources and my career to help free up more physicians to practice medicine and to enjoy their lives more. That makes money much more interesting, I think.
So your work is something that keeps you connected with that on a constant basis, it sounds like.
It does. I'm a big fan of macro problem solving, and arguably my role is more micro because we're talking about solving a similar problem for each individual person. So my big vision is that the physicians in Minnesota have the same stressors and problems and likely very similar solutions to those in Boston and in New York, California, Texas, wherever. So my big vision is to make macro change, systemic macro change. And I'm really excited about all of the data, for lack of a better term, that we have supporting that this works with the University of Minnesota, the University of Minnesota physicians, and other smaller orgs that are starting to see it and starting to catch on. And it all really starts with an advocate on the inside who's a decision maker and who can say, I think this is valuable and I think it's important and I think we should raise our hand to interview and ask some of these people. Very often, the gatekeepers, for lack of a better term, in medicine are very high, and rightfully so. I'm actually really grateful that they are, because there are some professionals, whether it's my industry or others, who they see revenue and fine, but that's not necessarily helpful unless you're incredibly good at what you do. So I really appreciate the advocates like Nick and like you who are able to say, this is important and we need to make sure that these resources are found by the people who are looking for them and that they're able to be connected on their terms. So thank you for having us here and for doing this, because this is the ideal outcome.
So Nick, if people want to learn more about you and your organization, where should they go?
They can go to umphysicians.org or can find me on LinkedIn as well.
Okay. And Katie, what about you?
Same. I'm on LinkedIn. My firm is Foster Klima. You can find us on our website. It's all linked to my LinkedIn. And then in the show notes, that will also help to connect me to you.
Okay, great. I thank you both so much for sharing this information, and hopefully it'll be the beginning of a conversation for many individuals and families in the medical profession to, evolve into financial freedom and success. So thanks so much for joining us for this chat on financial planning. And we hope this show has you thinking about your own career and what action you can take to make it ideal for you right from the start. If you've enjoyed this episode, please like and subscribe and tell others to join us. We greatly appreciate your reviews and comments, which help us grow to a wider audience. If you want to stay in touch, email us at practiceonpurpose@heyinfluent.com. Let me know what topics you want us to explore in future episodes. And remember, build your practice on purpose to stay connected to your purpose. I appreciate you joining us on this journey, and let's keep exploring together. Until the next episode.
A Huda Media Production.